Hello, I'm Representative Roger Goodman, and in today's Good Minute, we'll summarize the major accomplishments of the 2024 legislative session, which has wrapped up its business for the year. Our principal areas of focus, including boosting support for our public schools, the urgent concern of a dramatic rise in deaths and injuries on our roadways, persistent increases in the cost of living, particularly the cost of housing, and addressing the current crisis in behavioral health, including mental illness and the startling trend of deaths from opiate poisoning and overdoses. Ample funding for our public schools is constitutionally mandated as our paramount duty. And this year we responded to concerns from school districts across the state about three specific funding needs. First, we recognize that the basic operating cost for schools, including the cost of materials and supplies, has skyrocketed in the wake of the post-pandemic price inflation. In response, we enacted House Bill 2494 to increase funding for materials, supplies, and operating costs per pupil under what is called the prototypical school funding formula. This will provide much-needed flexible dollars to support our school districts, both large and small. Special education has long been underfunded, and this year we continue to increase support for those students with special needs. We passed House Bill 2180, which adds an extra $29 million per year to address the growing costs of special education, and also raises the special education funding cap from 15% to 16% of the student population. That legislation also requires a statewide review of the prevalence of disabilities so that future legislatures can ensure that we are fully funding special education services. This is a good step forward, but we must end the cap on special education going forward. Anything short of that is a disservice to our kids in our schools. Finally, we provided much-needed pay increases to paraeducators, office support staff, and other classified staff in our public schools, whom we often take for granted but are essential to the functioning of our high-quality schools. We enacted Senate Bill 5882, which will require school districts to use additional funding to support increased staffing, to prevent layoffs, or to increase salaries for those school staff members for the next school year. These are all important steps, but it's not enough. In future sessions, we must do more to keep our schools whole and support all of our students. This year, the legislature also tackled escalating housing costs. We provided more than $1 billion in increased funding for new construction through the Housing Trust Fund. This will help create more affordable housing options, coming in the form of grants from our State Department of Commerce. We also increased housing options by paving the way for co-living options, passing House Bill 1054, which prohibits arbitrary occupancy limits in common interest communities. And we also enacted House Bill 1892, which will accelerate the construction of affordable workforce housing across Washington. The other significant issue the legislature tackled this year is the very troubling crisis of overdoses from synthetic opiates like fentanyl. Here and across the country, we've seen an alarming increase in substance use disorders and deaths related to opiate poisoning. We took a multi-pronged approach to this issue. We've prioritized child and family safety by passing legislation to improve services to families and clarify child removal processes, including synthetic opiates like fentanyl. We asked the Criminal Justice Training Commission to develop model standards for canine detection of fentanyl and expanded cooperation between state, local, and tribal governments around serving tribal warrants. We're now requiring prevention education in the middle schools, high schools, and colleges to raise awareness of the dangers of fentanyl, the prevalence of fentanyl among other drugs, like how it's cut into pills, and how to recognize substance use disorder and overdoses. More importantly, we prioritize behavioral health and recovery in the budgets. The operating budget includes $215 million to address the opiate and fentanyl crisis, including increased medication for treatment, school-based outreach and intervention, family services and child safety, and support for our tribal partners. Another $245 million was allocated for behavioral health services to help people recover from substance use disorder. And finally, the capital budget invests $82.7 million in behavioral health center capacity grants to help build more treatment facilities across the state. The fentanyl and opioid crisis is an ongoing and escalating emergency that we need to address in a robust manner. I'm glad we've moved important legislation and invested significant funds to help us save our neighbors' lives. Now that the legislative session has adjourned for the year, I and the other lawmakers have returned back to our districts and embedded ourselves in the community again. I'm already beginning work on developing legislation for the next session in 2025. I take this job very seriously and really appreciate the honor and privilege of representing you in the State House. I encourage you to contact me, even to meet me for coffee or for a meal, with any questions or concerns that you may have. Thanks again for your interest in public policy and for your attention to these important issues.